Our newest segment, Simply Spectacular Smiles with Charleston Orthodontic Specialists. We extend a warm welcome to Dr. Nick Savastano along with Chelsea Scott to tell us about their coolest braces, which is really neat. I had braces years ago and they were just the standard metal that's there, but you guys have got some new options now, don't you?
Yeah, things have definitely really changed. The newest product that we have is Clemson and USC Gamecock braces, which are essentially the emblem of the teams on the braces themselves. We also have Wild Smile braces, which are different shapes, and they can be mixed and matched, and all the different colors. Kids just have a lot more fun with their braces nowadays.
And speaking of fun, Chelsea, this brings in the spirit of the child. Maybe it's a little bit of a runoff of mom and dad over there, but they can even feel even more happy about getting braces. We know that once they have the braces taken off, their teeth are going to be remarkably wonderful, and they may be messed up now, but they can also be sort of that supporting that fan, or the fan supporting Clemson and Carolina or whomever, right?
Yeah, absolutely. Preteens and middle school students love to express their individuality, and one of the simplest forms of self-expression is your smile, and we like for the students to be happy to show off their smile while they're in treatment. So that's why we like to have the Wild Smile brackets and the mascot brackets so that they can express their individuality.
Fantastic. You speaking of a child having braces, let's both of you question on both of you. What age would you look at if a child needs braces? So what is usually the youngest age? What is the age that you like to get them in the office?
Yeah, there's really no specific age that's better than the other. That's why we usually like to see the patient as early as 7 years of age.
Okay.
They can start as early as 7 years. Sometimes we just monitor the patient, and we'll see them every 6 months to see how the adult teeth are coming in. Middle school is usually the most typical age that they start treatment. They're usually more mature and can take care of the braces better, but it just depends on the case.
I had my braces back in the 60s. They've changed tremendously of how braces are installed, everything, the mechanics of the braces, the actual substance of the braces. Tell us about the transformation over the decades.
Yeah, over the last 20, 30 years, and especially last 10 years, a lot's changed. The wires themselves, which the wire is the piece that actually moves the teeth, has gotten lighter, more flexible. So we don't have to see the patients as often, so they don't have to come in as often. It's more convenient for them. Also, the braces themselves, the little brackets that go on the teeth, are much smaller. We use an American bracket made by American Orthodontics, and their brackets are extremely small. They're very hygienic. So that, coupled with, for instance, we don't have to take impressions of teeth anymore.
Oh, wow.
We actually can use a digital tooth scanner now and get a three-dimensional capture of the whole.
Things have changed. Wow.
So it's a lot more fun, a lot easier, and you know, we can avoid those messy impressions, and people love that.
Do you still use the rubber bands?
Rubber bands are very important. Pretty much everybody who has braces needs to wear rubber bands to get that final result, to get the bite exactly the way we want it. So yeah, rubber bands are super important for sure.
How about the brace that goes around the neck?
Headgear?
The headgear?
Yes.
Is that still being used?
It is used on select cases.
Sure.
Sometimes we need more than just the braces. We need a little bit more force. And the headgear does great to not only move the teeth, but help manipulate the jaw structures.
Yeah, I'll tell you what, it's so much has transformed over the years.
Absolutely.
And I remember going in, it would take days and days and days to get just even the smallest ones installed. And now, how long does it take? It's a very quick.
People are surprised that they can walk in for the first time. We take photos, x-rays, scans. We'll go over financial, we'll do some paperwork. And 40 minutes later, they're walking out with their braces on.
Wow.
And then we don't usually need to see them back for 10 to 12 weeks.
Gracious, that is
They come back, they think they're done because their teeth are so straight. But of course, then we have to start working on the bite, the alignment, the midlines of the teeth. But yeah, the technology has gotten much better.